Hi everyone, my name is Dr. Asamoah. I'm a GI specialist based here in Houston, Texas, and IBS is my thing. I love irritable bowel syndrome for many reasons, and I want to take a minute to talk about a question patients always have when they come into the office. Patients with IBS, they're like, Dr. V, I have a food allergy. I have a food allergy, and I'm very nerdy. I call myself Nerdy Asamoah, and I'm like, it's not a food allergy. Don't get the allergists all mad at us. So I'm gonna kind of talk about the difference between food allergy, food intolerance, food sensitivity, and give you guys a couple of scenarios. But we're gonna break this down because immunology, which is really allergy and immunology, is a very complex field, right? And so it's sometimes hard to understand, and I get it. I get it why patients often say, I have a food allergy, I don't know what I'm allergic to. Dr. V, like, can we figure it? Can we do the testing? So when it comes to food allergy, I always give my son as an example. He's got food allergies. When he was 1, I took him to a Thai restaurant and he started eating off my plate, and boom, literally less than half an hour, not even half an hour, literally 15 minutes later, his throat started itching, face was swollen, looked like he just got boxed in lost a fight in a boxing ring, and he couldn't breathe. He couldn't breathe. So a food allergy is IgE mediated. It happens fast. It happens seconds, hours, minutes, seconds, minutes, maybe hour to eating the food, but you can definitely tell the correlation between I ate the food and this happened. So it's an IgE mediated immediate response. You may get all sorts of reactions. Yes, you may get nausea, vomiting. You may get immediate diarrhea. You may get hives, rash on your skin. You may get facial swelling. You may get throat swelling, right? Throat closure, anaphylaxis. These are all systemic symptoms that could lead to anaphylaxis. And this is IgE mediated food allergy. If you eat gluten and 2 days later your tummy's bloated, that's not a food allergy, okay? So we really want to use the correct terms, because sometimes doctors get all like, yeah, what do you mean it's an allergy? It's not an allergy. Yeah. Just use the right terms. And so it also helps us understand, hey, who needs that EpiPen, right? That's a life-threatening condition. Who needs that EpiPen? Or who may need to see a food allergist specialist and really get the appropriate testing done and really decipher what food is causing the allergy. So IgE mediated allergy, boom, let's put that aside. Usually not our problem in patients with IBS. Now, let's talk about food sensitivity. Now, you may have heard of people talking about I think I'm sensitive to gluten. So we have things called, so I think I'm sensitive to gluten or wheat. And before we even touch on that subject, I want to make sure they've had a celiac serology, like a detailed celiac serology panel with gluten on board. So not if someone's been off gluten for 6 to 8 weeks or months, and you do a celiac serology, it may come back falsely negative. So you want to, in someone who you suspect, this may be a gluten sensitivity or wheat sensitivity, you want to go ahead and test them for celiac first. Get that out of the way. Tested them for celiac, you're like negative. Okay, now is this a sensitivity related to gluten or wheat? Because these are the most common ones, right? And we would call this non-celiac gluten sensitivity or non-celiac wheat sensitivity, okay? And so these are patients who will eat wheat, who will eat gluten. They will feel reactions several hours after eating the food. Now, this is delayed. This is a sensitivity, tends to be delayed, can be IgG or IgA mediated, usually a delayed response. We may even see it days after eating the food. And sometimes we'll actually even say that, we can see sensitivity reactions occur up till 21 days post ingestion of the food. So when you give up a food and you want to see whether, really was it the food item itself, you want to give it up for at least 3 weeks. When patients kind of, I gave it up for a week, I'm still bloated. I'm like, well, let's give it up for a little bit longer and make sure there's no antigenic response going on in your body that's still being mediated by IgG. So there's no like specific like test for it. You can do some food sensitivity testing through IgG. They're not always 100% accurate, but I've used some labs that have given me pretty good results, even on someone like my son who has IgE. So I love to do the test that will show me IgE, IgA, IgG sensitivity and look at that full panel. I even add on something called the immune complex sensitivity. I'll talk about that in a different video, guys. But today, I really just want to focus on the different types of food allergy and sensitivity. So we've talked about non-gluten, non-celiac gluten sensitivity, non-celiac wheat sensitivity. You may have this sensitivity to other foods. It could be corn, right? Corn sensitivity. It could be soy sensitivity. And so sometimes doing a 12-food elimination diet of these highly pro-inflammatory foods is helpful, and you eliminate for a while and then you reintroduce very slowly. And we have a wonderful protocol that helps our patients to identify what foods or sometimes what groups of foods are affecting you, right? Now, let me just stop for a minute and talk about wheat allergy, because wheat allergy, we see that quite a bit, very often undiagnosed. A lot of people think they just have an IgG gluten sensitivity or wheat sensitivity, but it is in fact a wheat allergy, IgE mediated. So one of the patients I had wheat allergy, we tested her, she popped up high positive for IgE wheat allergy, and every time she ate wheat, we then 15, 20 minutes, less than an hour, she broke out in hives. Her nose was super runny. She was itchy all over. Definitely a wheat allergy. Now, it never went all the way to the point where like her throat would close up and whatnot, but she kind of figured it out. And together, when we did the test and confirmed, we're like, okay, that's a wheat allergy. So that getting that history is really important when you're trying to see something that happened immediately, right? Immediate response, that's IgE, and elimination is the goal. Having that EpiPen if you have severe reactions is really important. We've talked about the sensitivities, we've talked about sensitivities to different foods, and then let's go on to talk about intolerance, right? So that's like sometimes you don't have the enzyme to break down certain foods very well, you don't tolerate it very well, so we have a lot of carbohydrate intolerance like fructose intolerance, we've got lactose intolerance, you have dairy and you're bloated, your gut is not just digesting it at that luminal surface, it results in abdominal distension, bloating, diarrhea. You've got histamine intolerance. Some people have something called salicylate intolerance. And here I think, you know, there's no perfect test when it comes to intolerance. I do a lot of carbohydrate, malabsorption testing. I put patients on a dairy-free diet to see if lactose is indeed the problem. I look at artificial sweeteners because that's an intolerance, right, of the sorbitol and the alcohol sugars. That's definitely intolerance. I kind of analyze their food diaries to see if histamine is an issue, and that is a possible intolerance. So there are those categories. And so when working with a patient with IBS, it could be either one of those. It could be a combination of those, but it's not a one size fits all. Again, my name is Dr. Vivian Asamoah. I hope this was helpful as we structured it out what kind of testing may be needed for what kind of allergy, sensitivity, or intolerance. It's not all the same. There is some specialized functional and integrative testing that can be done. Talk to a great physician who can help you figure out the best test, affordable and also high yield in terms of giving you the good results, and work with a team. We have an integrative team here with amazing dietitians that can walk you through your food sensitivity testing and guide you in terms of how to reintroduce foods. Because at the end of the day, guys, it's not about eliminating, it's about reintroduction and having that diverse microbiome. And if you're a foodie like me and you love food, I don't want to eliminate anything. Like, I want to be able to eat what's healthy for me. Of course, unprocessed, whole foods, organic, clean sources, nutrient rich. Again, my name is Dr. Vivian Asamoah. I am a GI specialist in Houston, Texas, a lover of everything that's holistic, integrative, and functional medicine. If you love this video, follow us, put in some likes, follow us to learn more about gut health, learn more reliable educational information about gut health. Bye, guys.